Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Bridge Financial, 100% Chiropractic, Chiro Health USA, Imaging Services, Chiro Moguls, The Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from our full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle.
Hey guys, welcome to episode 623 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Lisa Goodman. And if you want to hear about her book, The Manual for the Chiropractic Entrepreneur, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle podcast. It's 623. I'm really excited about today's show. Lisa Goodman and I have had a great conversation about all things chiropractic. I wish we had recorded it for everybody before we went live today. But you guys just have to come and see her speak at Palmer Homecoming this year to get all the good stuff from her. But I'm going to let you guys know a lot about what we're talking about today. She wrote a book called The Manual for Chiropractic, the Manual for the Chiropractic Entrepreneur. I got it right.
Got it right.
And I think it's a fantastic title. TIC capitalized, fantastic. And we're going to talk about practicing in Denver. Many of you know I used to live there for 6 years. And some of her hobbies, golf and CrossFit, which I know there's a lot of people out there that are CrossFitters and love the sport of golf. And we're going to talk about like associate convo and 18 years of practice. But before we get into Dr. Lisa Goodman's episode today, I'm going to let you know our big why. Why do we do what we do over here at Chiro Hustle? Well, first things first is freedom of speech. I think that is a fundamental for this nation and for this world. We've never censored anyone. We know what it's like to be traffic throttled. We know what it's like to be censored. We know what it's like to be shadow banned. I would never do that to anyone because I believe everybody has a voice and we need to allow them to be heard. We also support medical freedom and family health freedom. They're not the same things. If you need to know more about them, find a chiropractor in your neck of the woods and learn about family health freedom from them and medical freedom from them, because they will be the ones that will give you the best advice on how to take care of you and your families. Philosophically speaking, I can't do a show without mentioning these things, because if you don't listen to the entire show, at least you might listen to 2 minutes of our intro. Chiropractic is a very important profession, and the historical messages of philosophy matter. So we do protect BJ Palmer's Sacred Trust. If you don't know what that means, go to our show notes and check it out. It's BJ Palmer's last words. And chiropractors, you have to guard it well. And then we support subluxation-centered chiropractic, innate intelligence, and universal intelligence. We believe that when someone gets adjusted, it connects man or woman, the physical, to man or woman, the spiritual. And that's chiropractic philosophy for people that don't know about it. And that's the introduction to our show. And Dr. Lisa Goodman, welcome.
Thank you. Thank you. Good morning from Denver. Thanks so much for having me. I'm really excited to be here and talk about all of the things with regard to small business associateship and chiropractic.
So chiropractic, your story, I know you went to Palmer West. And you grew up in the Bay Area, you were saying. So what was the impetus for you to say, that's it, chiropractic's for me?
You know, when I was younger, since as long as I can remember, I wanted to be a doctor. I wanted to wear a white coat. I wanted to wear a stethoscope, and I wanted to heal people. And when I was in college, I did the thing where a lot of people volunteer and work in jobs to beef up their resume for medical school. And I worked in a lot of medical offices. And throughout that experience, I realized that to me, that wasn't healthcare. And I realized that that wasn't for me. It wasn't what it looked like on TV. So I did the natural thing and ditched that plan for a degree and a plan in marketing. So I was fortunate to work at two amazing branding advertising agencies, one first in Minneapolis and then in San Francisco. What's interesting, though, is sometimes your future and your fate are right in front of your face. I've been going to a chiropractor since I was a child, and I had a swimming diving injury, a whiplash, and went to a chiropractor. And I've been going my whole life. I have chiropractors in my family, an uncle, and I never thought of it as a profession, right? So I'm in San Francisco and I have a particularly terrible day at the ad agency. It was stressful. And I went for my normal adjustment at my chiropractor mentor, Dr. Jackie Bittner, who's a Palmer grad. She's amazing. And I was at her practice one day and I was just having a moment. And I said, God, you have the best job in the world. You help people every day. You own your own business. You have two amazing kids. You wear what you want to work. I mean, all of these things just went off like fireworks in front of me. And she said, yeah, you could do this too. So long story short, I had all my pre-medical prerequisites, which can be a bit of a stumbling block for people who want to go to chiropractic school later in life, is you have to go back and do all that. But I had it all. So 3 weeks later, I started at Palmer West. I graduated as valedictorian, and the rest is honestly history. Things happen when they should happen. I think that my background and my ability to work in marketing for 4 years specifically at branding agencies was invaluable in opening a practice. And then of course, all the evolution since then.
Yeah, you said something really important there, marketing. And I think that, chiropractors go to school and to become doctors,
Right.
and they don't go to school to become marketers. So it's really cool that you came into the program with a marketing foundation. I'm sure it's helped you tremendously.
I had an advisor at the University of Miami. I was a biology major, and she said, don't go biology. If you want to go to med school, differentiate yourself. What is your actual passion, your actual interest? And I said, well, art. I've always been into art. And she said, get an advertising degree or a marketing degree. And so I did. But at the same time, I had to do double duty to get the prerequisites. But I've never lacked in ambition. So went ahead and did all of that. And it's a piece of advice I give when I speak at high schools now is there's no wasted class. There's no waste of time. There's no wrong decision. Oh, did I take those classes and I wasted time? They will come back to help you later. They always will, if you want them to, right? If you leave room for that. So major in something that interests you. There's always grad school. There's always mentorships, apprenticeships to get you into the career that you're looking for.
We were just talking how we were both recently in Mexico, and there was this big castle down in the city called Teplotzan, or I think I'm saying it's right, but they extracted all the books from the castle and put it in this library in the town square. And I went there yesterday and I said, there's so much freedom in a book. If everybody just sat here at this free library and read these books, how much more educated we would all be. And I just think it's amazing that you go back to the root. Whatever you become educated in, it doesn't go for nothing. And we can always go back and connect with our past knowledge base and develop that forward. And I know that we had a really great conversation before we started this episode. And I do believe that we can continuously drive the profession forward with enough knowledge. And if people just stay educated the right way, and even if it's in topics that aren't necessarily chiropractic, it can all adapt into the profession.
It should adapt into the profession. And that's what makes us unique, especially the entrepreneurs, the small business people that are community based, and that, every patient that you need for your practice to be successful is within your zip code, potentially within a 4-block radius of your office. Being a community-based practitioner, people come to you and continue to come to you because of the whole person that you bring to the profession and to the table and to the community and to the family in front of you. That's why there's no competition in our profession. I heard you say the other day, it's 14% of all patients or of all people see a chiropractor, or maybe 10%. Like
Mhm.
the growth potential for all of us to have a waiting list practice is like unlimited for the next hundreds of years. There's so many people that need what we do, and not every patient is going to be the right fit for every chiropractor, and not every chiropractor will be the right fit for the right patient for every patient. So the idea that a practice could open up across the street for me just has never bothered me, because they're not going to be the same people that I would see at my practice.
I love that perspective. My first mentor's name's Dr. Fred Schofield. And Freddie would always tell me when I'd go to his seminars, he'd be like, you could put a practice here and a practice there. They could both see 500 a week, and people would never go to the other chiropractor's door because that's the person that they're supposed to go to. And he would always tell me, if there's a chiropractor practicing and they're seeing 100 a week, and you put them in practice that's seeing 500 a week, that clinic would then start seeing 100 a week. But he's like, if you took that same practitioner and seeing 500 a week and you put them in 100 a week practice, that practice would grow to 500 a week. He said, because
100%.
it's the threshold of the practitioner.
I talk a lot about the threshold of the practitioner, because you can set goals, right? You can have a job description with your associate and set goals and say, this is mathematically what I think you can see this week. And they will nod their head and agree and look at the money and say, sure. And they will 2 or 3 years later, they haven't hit that number yet. And it's because of their capacity and their threshold. And that can be a known conscious decision, or it can be a comfort zone, and any of us will intentionally schedule for our threshold.
I think it's something that definitely needs to be discussed in this profession when it comes to the ideas of being a high volume practice.
Mhm.
I've kind of coined the phrase, chiropractors need to have a mindful volume practice, and they need to be mindful for themselves, because the more subluxations that they're correcting, that energy comes back into them. And it's a very energetic profession. It's not just mechanistic, like, hey, come in here and I'm going to pop and pray and your life is going to change. No, the chiropractor has to be in tune with the practice and the science, philosophy of art of what they're doing. And they have to be capable of taking care of people.
Yeah, I mean, that's correct. And on the same note, if there are patients who are doing the opposite, taking energy away, it is a practitioner's responsibility to potentially find another fit for them somewhere else, because that can actually damage your entire day, right?
Mhm.
And you don't like to really think that way, but it's just the truth of the matter. Some people are more energy, more maintenance, and more than you can give, which is rare. It's rare, but it does happen, right? And acknowledging that's growth.
And you have to be able to facilitate and be a practitioner. And, I was just listening to my buddy Liam Schubel speak down in Mexico City. And he says, in our offices, he has like 30 of them in Latin America. He's like, we don't talk about sports. We don't talk about the economy. We talk about chiropractic.
Well, I could do better with that. In our offices, we streamed the new Taylor Swift album yesterday, and we talked about the Nuggets playoff game last night. And we love being, in Denver. Like, come on, Denver is the headquarters of active families. And we have an amazing nutritionist, Carolyn Scott. But it's difficult because my patients eat healthier than I do in Denver. My patients understand activity and fitness and health like you wouldn't believe, right? And anyway, all that stuff is so important to them. So we're always watching golf in practice and talking about the Nuggets and the Avs.
And
Not the
that's just
Rockets
it.
so much.
Well, I think it's really, it's appropriate for the practice and life you create.
Yeah.
And I think that that's the design of your life. All
Yeah.
chiropractors can do that once you become the doctor of the future, or maybe the present. I think that Thomas Edison had a quote that said, the doctor of the future will
We'll give no
do,
medicine.
Here, yeah, finish it for me.
Because will teach about disease, prevention of disease. We have that up in our office as well. And it's just like, there's so far to go in medicine. It's like, how are they getting educated? Like, how are they getting educated about caring for a human being?
Uh-huh. Yeah. And I just think that, there's a lot to be said there when it comes to how the practitioner decides to run their private practice and how they want to connect with their communities. And anybody that knows me, they know I'm more of a fundamentalist. Like, if it's chiropractic, it's chiropractic, it's chiropractic. One of my good friends, Eric Plasker, would say chiropractic first, chiropractic second, chiropractic third, chiropractic fourth, chiropractic fifth, chiropractic and drugs if needed, sixth, chiropractic and surgery, seventh, and chiropractic and any other intervention after that, eighth, ninth, 10th. But also, when you're doing that, don't remove chiropractic.
Yeah, never remove chiropractic. And I believe in chiropractic first for everything, the inside out,
So the book, let's talk about that, because I think it's really a cool opportunity for you to showcase the manual for the chiropractic entrepreneur. And there you are. Look at you.
There I am. Got two different looks. Got the natural curls and the straight, Always keep everybody guessing.
So tell us about the book and what was the big idea around creating a book.
When I was in chiropractic school, I was fortunate to do 2 internships, which, as a side note, I do think it's difficult. Another difficulty of graduating in our profession is we really, really lack mentorship when we graduate, which we'll just, for sake of language, call it a residency. And in the medical profession, there's this opportunity to spend 3 years at a low paid residency, work your butt off, and build your knowledge base. And we don't do that in chiropractic. We do, if we're lucky, a 10-week or a 3-month internship in a clinic where sometimes some states don't even allow adjustments in those internships, right? But I'm okay with that in the sense that they're geared toward learning how to run a business at the same time. So I graduated, I did 2 internships, and I looked around for an associateship briefly, but there wasn't anything here at the time, or anyone hiring at the time, that matched up with what I wanted to do. And I have never lacked in ambition, and I have a really supportive husband. So I said, let's just open a practice. And so I opened my practice on a shoestring budget. Oh, I couldn't get a loan. I mean, you can't get a loan. Like, the best part about trying to get a loan is, well, excuse me, the bank says, excuse me, will you show me where you have 5 years of experience running a small business, and then we'll give you a loan. So the point of me needing a loan is that I'm trying to open a small business. So that was something I didn't expect. I had a business plan written. I had everything I needed, and I couldn't get a loan. So I had a credit card, a Capital One card with $5,000 limit, and I opened a practice. So number one, part of the whole purpose of the manual is, how can anybody open practice from scratch? You can do it. You don't have to get a $250,000 loan, or have your parents back you, or have a beautiful practice with all of the techniques and all the equipment and all the bells and whistles. You need your hands and a table, right? And that's it. That's all you need, is your hands and a table, and the rest is pretty cheap. So to answer your question, though, it was probably the week I opened my practice, I thought, I have no idea what I'm doing. I don't know how to set up a business. I don't know how to, what taxes I'm supposed to pay. I don't know what provider numbers I need. Even if I'm not taking insurance, I need certain numbers. I don't know. And I knew a lot about marketing. Marketing was all I knew that would get me through. But the rest of it, I was just figuring out. I was calling mentors. I was calling the Chiropractic Association. I was on the phone every day with somebody. And I remember thinking, I'm going to figure this out, and then I'm going to write it down so other people have a resource and they can figure it out when it's their turn. And that was 18 years ago. But I knew I needed some experience and some credibility before I could actually start telling people how this works. And so 3 years ago, I sat down and started writing, and then we just got published in February. It was really exciting.
Well, I come over to Loveland to do some work at the end of June. So I'll make sure that I pass through and grab a copy of your book. And I think it would be really cool to learn from. Marketing fundamentals. What worked for you back in 18 years ago?
2006. Yeah.
What worked for you back then really well, and what's working for you today?
What worked for me in 2006, and what I think is still the foundation of a community-based practice, is one-on-one marketing, grassroots marketing. However much time and energy you're willing to put into it, it will pay off big time. I know that the internet is really also where it's at right now. It can be kind of expensive, and my goal has always been I can pay $0 and convert patients into my practice. And then once I convert a patient into my practice, they become my army, converting other patients to my practice. So kind of two things. The first was identifying where my audience might be. And that might be at a personal training gym, or it might be at a CrossFit gym. I've got a bunch of conversation starters for that kind of thing. But typically, it's where do you go in your regular day? Don't go somewhere that isn't your playground, right? When you're starting out, start out with people who you see regularly, that you see often, that you will go back to. For me right now, it's as simple as going to my kids' high school JV baseball game and sitting in the stands next to a different parent every time there's a game. It always comes up. Oh, what do you do? Oh, what do you do? I mean, that's not even as complicated as it needs to be. It's more like, oh yeah, I just got Tommy adjusted yesterday and look how fast he's running. And they go, what's that? So you just bring it up in your normal conversation, and it furthers what we do, even if the patient doesn't end up, or the person doesn't end up converting. So I think one-on-one marketing is number one. And number two is internal marketing, because I could have named this book, How to Grow Your Practice from One Single Patient, because that's all you need. Because once you have one single patient, it's what are you doing inside your practice that is teaching them to then send their family and their friends and their neighbors to you. And you don't have to do any more of it. And besides that, the referral that comes from that, they've already been educated. They already know what it costs. They already know how often their friend or family comes in. They already are so excited to meet you. And if you have a waiting list practice, they don't mind waiting 3 weeks to see you. So the internal marketing for me is so inexpensive, and it's so fun, and it's really all you really need to do, in my opinion.
And I love so much of what you just shared with us, because there's so much value for the person that will listen to this, whether it's a patient. A lot of times our audience is now mainstream. Like, people that aren't chiropractors are listening to what we talk about, and they're like, wow, those are really great business strategies, not even for a chiropractic office. Right. And yeah, we do have to be connected to our community. Yeah, this all makes sense. So I think that people that are listening to this will have some light bulb moments with what you just shared with them. And I love this line, all you need is your hands and a table to become a chiropractor. And
to become a business owner.
Yeah. And how you grow your practice from one single patient. I think those are just really like great takeaways for people. And there's so many students that listen to our show, and they're like, well, what do I need? And I can't tell you how many messages I get from like young DCs, like, hey, can you tell me like who to listen to? What episode do I listen to? And I'm like, well, I'm kind of like, I'm joking. I say, I'm like a mom. I love all my kids the same. Like, I love all my episodes the same. But I think that if there is like a chiropractic student that was really curious about getting to know how to run a practice, this would be a really good episode for them to be able to attach to, just because I think there's so much knowledge as to, you don't have to spend $3,000 a month in ad spend on a Facebook campaign, or figure out how to do a TikTok thing, or how to grow an Instagram account. Like, I think those things are valuable, but it takes away from the practice. It takes away from the practitioner. And chiropractors aren't producers, really. You guys are healers. So say, hey, go make these 10 videos this week, and we're going to put a campaign together for you. It's just not natural.
Like, I love social media and I love making content, but most of it is because my motivation is educating and sharing what we do. So you always have to understand your why and your purpose. And anytime you're speaking next week, every time I speak, I sit down and say, why am I talking about this? So when I'm talking about social media, or even when I'm approaching a gym and trying to sell myself, I don't think of it as like trying to sell myself. I think of it as, what value can I add to this person today? And I will never forget the first personal training gym I walked into. He was busy. The owner was busy. He was shooing me out the door. He was like, sorry, I don't have time. I said, just give me like 1 minute, really quick. I said, I just opened a business down the street, which, by the way, is my favorite opening when I'm marketing one-on-one, is not to say I'm a new chiropractor in the area. I say, I just opened a business down the street and I wanted to get to know you. And he said, oh, what's your business? Totally disarmed him, right? I said, well, I'm a sports chiropractor and I'm interested in helping any of your clients if they need it. He cut me off. He said, we work with a physical therapist. We love her. I said, oh, I'm really happy to hear that you already have someone helping your clients, but I'm only going to leave you with one thought. If you have if you have a client that your PT is not successful with, your hardest case, you're going to lose them as a client, send them to me and let me see what I can do. And that was it. And he did. He sent me a double plantar fasciitis patient the next day. And thank goodness we got her better. But you just go out there and you say, give me something difficult. Like, I want to help you. And I could have gone in there with business cards and said, hey, I'm a chiropractor. Like, let me know if I can help. And he never would have sent me anyone. So, like, so much of it is in your intent and what you actually mean, and if you can back it up, right?
You made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Bridge Financial, 100% Chiropractic, Chiro Health USA, Imaging Services, Chiro Moguls, The Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from our full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle. And that's the power of chiropractic and the adjustment. And that's the fundamentals of this beautiful profession. And Clarence Gonstead said it the best: find it, fix it, leave it alone. And I think that when you think about the philosophy of that, the chiropractor does. They find it, they adjust, and the body self-heals and self-regulates. It needs nothing extra in it. It simply needs no interference. So when you clear up the interference, the neurology says, oh, wow, this is how I'm supposed to feel. And then it starts to regulate and adapt. And I think a lot of times people come to this point where they're maladapted and they have symptomatology and they're like, I don't know what to do. My foot hurts.
I get so excited when a new patient has tried everything, but they've never been to a chiropractor. And I say, oh, you're going to get better. And they say, how can you know that? I've done all the things. I've done needling and PT, and I've rested and I've had injections. And I say, I know, but you're going to get better.
See, I love it. The one-to-one modeling. You have to be able to have so much confidence that the people that are with you know that they can trust you. And I know that we've gone through the past 4 years where people are starting to have lack of trust within the medical world. So I always try to get people to say, hey, try the chiropractic and try them first and let them be your referral model. Like I say, all we want you to do is have a better quality of life.
I love what you just said. And I think that, I think I'm going to borrow this. We are a profession of trying it last right now. Everybody has tried everything. And now chiropractic's my last resort.
Mm-hmm.
And the number of patients who tell me and tell us as chiropractors, man, I wish I had seen you first. This would have alleviated years and financial burden. and years of suffering. And it's something I know, and now you've put it into words. Like, try chiropractic first.
Well, it's an honor for me to be able to make a complex thing easy to understand. And what I've seen over time after scheduling in 10,000 new patients is I run into so many people that say, "Oh, I don't need a chiropractor. I don't have any issues." And then I'm like, "Well, do you know what your spine looks like?"
Yeah.
And they're like, "No." And I'm like, "Well, if I was in charge of like our country, I'd have everybody walking around with a hologram of their spine on their ID card, so they would know what their nervous system looked like, so they would know what health really looked like." And
Yeah.
I think it sounds like super like outside the box, but imagine if everybody that had an ID carried around had a hologram on there of an image of their spine, so they would know what their neurology was doing and what their spine was actually looking like, to where they would know where their baseline of health was. It wouldn't be a blood type. They could have that too, but it would be, what does my spine look like? We would change the whole GDP of health in this world if people just knew what their spine looked like.
Yeah. I mean, one of the simple pieces of education I try to help my patients visualize is that I kind of have this imaginary grid on my wall. I just use my hand, but I say, most people think that optimal health is sort of here. And they come in to see a chiropractor when their health drops below that, or a doctor or whoever. And we can get you back to here, that's actually easy. But wait until you see what it looks like to live here. So that's the injury care model, right? We can fix you, get you here, but that's the wellness care model, and the performance care and the prevention model is wait till you see what else there is available to you.
It's like saying, I only drink water when I have a kidney stone.
Yeah. I mean, I've heard people say, well, I only take medicine when I'm sick. And I'm like, well, okay, yeah, that's not the same thing.
So I really want to touch on a few questions that are at the later part of our interview question set. I'm very curious because you have such a foundation for Upstart. You have such a foundation for supporting chiropractors. You have such a foundation for community. What is your perception of where the profession is going, and how can we support the things that you're already doing?
So I think that the profession is still in its infancy. I actually was thinking about this morning, and I think it's really similar, if you'll indulge me for a minute, in what's happening with women's sports. Because in a way, women's sports for years have had this tiny, very dedicated following, very loyal following, but nobody else paid attention. And why didn't they pay attention? So we can look at this for the same reason we look at chiropractic. We have a tiny, loyal following, but why isn't this catching fire? So what does everybody say about women's sports? They say, well, it's Caitlin Clark. She's just come on the scene. She's fantastic. She's amazing. It's not Caitlin Clark, though. It's the response to Caitlin Clark. So what I'm going to say is, it's the media response to Caitlin Clark. It's the media promoting her, and then therefore promoting women's sports. It's the airtime they're getting. It's the women's golf is now getting more major airtime. And now all of a sudden we have ratings that are better than some of the men's sports ratings. And there's a responsibility to them now, to keep that going. But I kind of look at it the same way. We have this small, loyal following, and we have to get that bigger. And what do we need to do that? We need somebody like you, right? Who, like you had mentioned earlier, can we get you on more mainstream podcasts, more areas where we need some media attention? I don't think all media attention is good media attention. We're getting a lot of media attention on TikTok and Instagram from how loud can this crack be, and how revealing can the clothes of my patient be. And I don't really know what to do with that right now, but I like my Instagram and my, what's really happening in a practice, and how is chiropractic really helping people. But the point being, I think that we need some sort of combination of of media attention. We need our obviously our loyal followers aren't going anywhere. And then lastly, I think we need some collaboration with what is already established. And now like that may be a little bit uncomfortable for some people, especially the more philosophically heavy listeners, because in order for us to break through and share our philosophy, we have to have the audience. And so I think collaboration with medical conferences or collaboration with other professions in conferences where we're doing things together, and medical doctors, I mean, they're not learning about us in school. They're not learning about collaborating with us in school. So we have to start doing that from the outside. And again, we can do that one-on-one approach. And that's really what I try to do. But at the end of the day, those are things I feel like we need to do is sort of more media attention and more collaboration in other areas of healthcare, whether we like it or not. But for right now, it's sort of the one-on-one. And 20 years, I mean, I don't know. I would like to think that we are no longer sorry, I know this has been long-winded, but what I'll wrap that up by saying is right now, I absolutely hate when you overhear someone say, oh, I got to leave, I'm going to the chiropractor. And the person next to you says, why do you go to a chiropractor? Because what needs to happen in the next 20 years is it needs to be, oh, I'm going to my chiropractor. Oh, who do you see? I'm so interested. I need a new chiropractor. I just moved here. The change needs to come from why do you go to who do you go to? And I need that information. And so that's where I'm seeing us head and where we need to head as a profession, because it seems pretty much like nothing has really changed in the last 20 or 40 years to me.
Can I share a couple things to expand upon
sorry,
that?
that was really long.
No, it was great. It was great because I love the way that you talk about parallel chiropractic with women's sports. 15 years ago was when I started working at a chiropractic clinic. I was bartending in Davenport, Iowa. The guy that was working the door at the piano bar that I was bartending at said, hey man, you're really good with people. Do you want to come help me open my office when I finish my chiropractic degree? I said, bro, I don't know anything about chiropractic except when I get adjusted, I feel better. He said, perfect. So it was a deep, long night at 30 years old. And I said, you know what? I'm going to dedicate the rest of my life to promoting this beautiful profession of chiropractic. And that, to me, is different than we have changed a lot in the past 20 years, at least with my inclusion. And we are doing better, and we can tell the story. And the first chiropractic seminar I went to was 11 years ago, and the doctor was named Joe Borio, and he must have said it like over 100 times during his talk, tell the story, tell the story, tell the story. And as soon as I heard him say that, I dedicated myself to say, you know what? I'm only going to tell this story. And I think if every chiropractor listens to this segment and understands what you said about women's sports and what I have to say about dedicating your life to telling the story, this profession will become what you want. And it will become everybody saying, of course I go to the chiropractor. It's great. I don't want to be subluxated. Like anybody that is subluxated has a lesser quality of life. That's crazy. I was driving down my first day in Mexico, and I'll be brief with this one because I have two more questions for you. I said, if we were to adjust C1 and C2 of every person making bad decisions in this world, they wouldn't make bad decisions anymore. They would all be clear. They'd be connected to themselves, and they wouldn't make bad decisions. They wouldn't be ruining our cultures. They wouldn't be ruining our governments. They wouldn't be ruining our economies. I was like, they would be clear, and they wouldn't have the capacity to make bad decisions because we would have them clear of subluxation, and they would all be more fundamentally capable of making better decisions. And
yep.
I'll leave that like little bit right there, but I'm really curious. Besides Dr. Jacqueline Bittner, right?
Yes.
Who are some of your other heroes that have helped you become the woman that you are today in chiropractic?
Boy, well, at first, I mean, I had an amazing dad. My dad was so ambitious and creative, and he never lacked for work ethic. I mean, let's have an entire podcast about work ethic, because in our profession, that is also missing. We go to school to be doctors, providers, healthcare providers, and people don't realize how much you have to work to make that happen. So work ethic, right? But so my dad was my hero where that comes. And actually, my dad was a huge chiropractic fan. And one piece of advice he gave me when I started my practice was always leave your patients with something unexpected and extra, because his experience with chiropractic in more of a high volume practice was sort of the same thing every time in a way. And we get that question all the time. Are you just going to do the same thing every time? And my answer is usually, well, pretty much it's going to look like and feel like the same thing for you, but it's not the same thing. What we're doing isn't the same, but there's only so many areas of the body that are going to be adjusted. So nothing wrong with that. But my dad had said, leave them with something unexpected. So there's always an anecdote of knowledge. There's always an anecdote of touching, assessing something they didn't come in complaining about in my practice. There's always questions, deeper questions about life or what's going on. And so I always remember that from him. Chiropractic mentorship for me has been largely local. When I came to Denver to open my practice, I didn't realize that I opened my practice across the street from another chiropractor, Dr. Stephanie Canada, who's retired now. And it was across the street, but they were perpendicular. It was around the corner. So I didn't know she was there. There wasn't really Google Maps and that kind of thing back then. And when I discovered she was there, I discovered it because someone came in looking for an appointment at her office, and I had better signage and better location and better visibility. So people would come into my office thinking it was her. Eventually went over and introduced myself. So I did this throughout Denver. That was the day I realized. She took me to lunch. She asked me if I was interested in covering her practice ever when I'm starting out. We went to lunch regularly. We adjusted each other. And that's when I realized the value of finding mentors, which is really chapter 1 of the book, is starting to make connections in school. Make connections right now. Find mentors who want to help you succeed and aren't going to, quote, eat their young, like you hear about all the time. And when Stephanie Canada retired, I want to say 5 years ago, she called me and said, look, can we go to lunch? And I said, yeah. And she said, hey, I'm retiring. I'm putting your information on my website and my newsletter. I'm sending everybody to you because who else would I want to take care of my patients? There was no buy my practice, buy my list, pay me for the opportunity. It was just a gift from somebody who had been a mentor of mine. And that kind of leadership in my life has been the reason that I do what I do and the reason that I mentor the way I mentor. And every associate that's ever worked for me, when they leave to open their own practice, it's with my blessing. And it's with, well, not every, there's like 2, but it's with, every time it's come back. How can I help? Call me if you have questions. What else, how can I support you? Because I want the bigger picture is the betterment of our profession, the betterment of chiropractic. And I just have such a passion for that. And I don't even really understand it myself, but it matters to me,
I leave people with this a lot of times, and I really appreciate what you said there about connecting with other chiropractors, because when I give my talks, I tell them, make a list of every chiropractor in your town and go have lunch with somebody for the next year. If there's 52 chiropractors in town, go have lunch with the new chiropractor every week. So you can become a cross referral. Because like you said early on in our show, sometimes you have to fire a patient and you got to send them somewhere else. And somebody's a better fit. But if you don't know who a better fit is, you're throwing them back to drugs and surgery. So don't do that. But in the closing of my last segment with you was that doctor that hired me on day 1, he said, our job is to help more people. And I still have that truth deep inside my soul today.
Right.
Our jobs is just to help more people. And I think that what you said about this Dr. Canada with you is her job was to help more people. And she had to be able to pass on that to you because she trusted you. And I think that that's a really powerful thing, is when you build a relationship, it's not about the money, like you said. And I think it's really pure. And a lot of times I tell people all the time, if you want to make $1 million, you know what you do? Help 1 million people.
Right.
Help 1 million people, you'll make $1 million. I guarantee you.
It's so simple. I know this phrase gets overused. Well, maybe not overused, but appropriately overused. And I use it all the time, right? Abundance begets abundance. High tides raise all ships. The more that we can support each other, the more successful we will all be. There's no room for I'm better than you right now in our profession. When someone at my gym, one of my favorite opening lines to recruit a new patient is noticing something, and I say, "Oh, I noticed you modified the shoulder press ups today. Do you have somebody who's helping you with that?" I don't even say what I do. I just ask if they're getting help. If they say, "Oh, my PT is amazing. Yeah, I've made a lot of progress." Even then I say, "Great. I'd like to be another set of eyes on that from a chiropractic perspective, if you want that, if you're open to that." There's always going to be a great, I'm glad that you're being supported. Ideally, they say they're seeing another chiropractor. And if that's the case, I'm happy for that. I don't say, "Oh man, no, you should come and see me instead." But I will always say, "Hey, if you need another set of eyes, I'm here. I'm happy to see you." And another thing I say a lot, and I believe, is that you don't actually have to have one chiropractor. We have patients who live in Fort Collins and work in Denver, and there's no reason they can't have more than one person working on their health. We don't have to be competitive in like, you have to stay with me. And even within a practice, you can see any of the providers, but sometimes people think they have to have one chiropractor. And I mean, I can see multiple massage therapists, right? So I think just to capitalize on what you said too about meeting with chiropractors and having lunch with them. Once you go from your table in your hands and you start building, you will create a practice where you have some other modalities or some other, let's use spinal decompression as an example for disc herniation, et cetera. Now you've become that practice where the new person with the table in their hands may find themselves needing that referral. And why are we not referring within our own profession first instead of referring instantly to ortho or neuro or something else? So knowing that someone specializes in pediatrics or women's health or sports care or Atlas orthogonal, like you need to understand what all these professions do, what these certifications are, how they're going to care for your patient. And we're all going to work together and collaborate that way.
So one more question, but I'm going to mention a few trails onto what you just said. I've done over 700 spinal screenings, and there's always somebody that walks by as, "I don't need a chiropractor. I see a PT." I know you've used a lot of cross reference to this today. So I think it's very appropriate for me to say this. I say, it's great. There's room for everyone at the table.
Completely.
I say it's important for you to see the PT, but they don't do what chiropractors do. I don't know if you know that. And I'm not here to tell them that they're wrong, but I'm very brash with them. And I say, what your PT does, they don't do chiropractic. They're different. And
Right.
I say, but I will let you know, I'm proud of you, and there's room for everyone at the table. And if what you need isn't getting corrected by PT alone, think about us the next time you think about chiropractic. So I don't burn the bridge. I offer opportunity to them. And the last thing is, my mentor that taught me how to podcast was a chiropractor. His name is Ed Osborne. And his real symbolism was, for all chiropractors, we're more alike than we're different.
Correct.
And we have to build that global community of nurturing rather than saying, "Hey man, you're wrong. You don't adjust like I do." Or, "Hey man, you're wrong because you have a different type of practice system than I do. But you're all right." And then my first big talk I gave in Boulder was called Unity Through Diversity. And I said, chiropractors are all alike. If I go to see you, you're going to adjust me different. If I go to see the next person I interview, they're going to adjust me different. And there's a lot of diversity within this profession. So we have to start unifying the profession as a whole rather than to say, "Hey man, you're wrong." And I think that that's really a great way to come to the edge of this interview with you today, is we're all more alike than we are different.
Yes.
But if you can just close us out with one miracle story, something that you've seen over your past 18 years. I know I kind of prepped you for this with the question set, but what have you seen that might inspire somebody else to make chiropractic their first choice?
I am going to take this in a tiny bit different direction because first of all, miracle stories happen so regularly to chiropractic that it kind of becomes
The norm.
mundane. So I
It's the
will answer
normal.
your question initially to say that infants is where I see most of my miracle stories. Infants in sleeping, colic, torticollis, nursing difficulties, the parents who call me in tears, minutes, I mean, instantly in front of you, but also the next day and let you know that was a miracle story. But what I want your audience, particularly the students out there, to understand is the real value that we have in the healthcare system is gigantic. Someone asked me yesterday if I was a medical intuitive, and because I was sharing stories with her about all of the different severe diseases that I've detected in my treatment room. And I had a professor once who said, if you don't find cancer, you're not looking. And I have found so much of that, and mostly in pediatric cases where pediatricians have missed it. I've found retinal blastomas and cerebellar glioblastomas and clavicle fractures and scoliosis, right? And things that chiropractors, that medical doctors, pediatricians have just bypassed, and they've just treated with medications and referrals. And my own dad had pancreatic cancer, and he had seen four medical doctors before I said to him, I think it's your pancreas. They gave him drugs for diabetes. They gave him drugs for acid reflux. They gave him muscle relaxers for back pain. And nobody put together the whole person. And as a chiropractor, we have an opportunity to connect with our patient on a level that a medical doctor will never have. They rely on testing and prescriptions to, quote, see if it works. And we don't have the, quote, luxury of seeing if a drug will work in order to come to a diagnosis. How backward is that we try a treatment to come to a diagnosis in the medical world? Or we try a surgery to see if we find something. With us, we have to talk to our patients, and we have to listen to their stories. And we take that data and that information in our brain, and we say, this is what it sounds like is going on. So we talked off camera about how we have to assess and make sure that patient is an appropriate chiropractic patient. We do a really in-depth physical exam. Then we present to them all their opportunities for improvement through chiropractic. But it's during those times in ongoing care that we can really be part of a person's life or death in chiropractic practice. And I don't think enough of us realize that impact that we can have on patients.
I'm going to close out with one thing, and I appreciate you sharing that. I interviewed a guy named Les Brown a couple years ago. He's world renowned as a motivational speaker. And he said, the reason I love chiropractic because it doesn't cut it out, drug it out, or burn it out. And I could say that a million times over and over and over again. Like Joe Borio said, tell the story, tell the story, tell the story. It's a huge cultural reference. But BJ Palmer said this: have you more faith in a spoonful of medicine than in the power that animates the living world? And chiropractic is very specific, and it works whether you believe it or not. And one of the guys that I loved the most was Sid Williams. He would drop the keys as assemblies at life. He would say, chiropractic works just like gravity. It works whether you believe it or not. You don't have to believe in chiropractic. You just got to get on the table and get adjusted. And there's so much truth in that. And I do the screens all the time. Somebody will come up to me and they're like, I don't believe in chiropractic. I go, well, I don't mean to tell you you're wrong, but I'll tell you, do you know what a belief system is? The Easter Bunny and Santa Claus. That's a belief system. I go, chiropractic is a healing art. And I go, if you believe in wanting to make an improvement in your life, come see us. And I think that there's a lot of truth when people are very confused. It's not about us against them. It's just we need to tell a better story. And we need to culturally connect to these people, because if we don't tell them the truth about chiropractic, someone else will close them for drugs or surgery.
Yeah, 100%. And we have to be a resource for them for their overall health. We are as primary as it gets. See chiropractors first.
I was talking to a group in Mexico City that does marketing, and they were really proud of their business. And I said, look at it from this perspective. If they knew what we know, they would do what we do. If they knew what we know, they would do what we do. It's very fundamental, very simple. And chiropractic first. Dr. Lisa, if people want to learn more about you, get your book, and connect with you, where can we send them to?
You can send them to my Instagram, which is Dr. Lisa Goodman. It's Dr. Lisa Goodman. And also the website is drlisagoodman.com. The book is the manual for the chiropractic entrepreneur is on Amazon right now. And it's literally a $25 way of taking any vision that you have and figuring out how to make it a reality, where there are wonderful, amazing coaching services available and mastermind groups and coaching groups. This is such a nice way for a student to even consider, do I want to be a chiropractor or do I want to open my own practice? Read it and get a sense for how much work it's going to take and get a sense for if that's for you or not. So thank you so much again for having me on. I really appreciate it. I had a lot of fun today.
Well, I typically go between 30 and 45 minutes, so we're almost at an hour. So it must mean I really enjoyed today's conversation too. Go check out Dr. Lisa, Dr. Lisa Goodman on Instagram and drlisagoodman.com, and check out her book on Amazon, The Manual for the Chiropractic Entrepreneur. This is episode 623 of the Chiro Hustle podcast. I close out every time by saying, you guys are just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now, Lisa.
Bye. Thank you.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.